Welcome to the Employees Group Insurance New Employee Benefits Orientation. This section is about health insurance. The purpose of this video is to provide you with the necessary information to enroll in insurance benefits as a new employee. Please see your plan booklets for further information regarding benefits. You may also call Employees Group Insurance with any questions. Through the state of Wyoming, a contribution of roughly 82% is made towards your premium of health, preventive dental, and life insurance. This amount is considered part of your total compensation, and this benefit is non-taxable. Check out our premium calculator on our website to determine what your portion of the premium will be. This table shows the 5 levels of the state contribution. The split option is when there is family coverage, but both parents work for an entity that the employee's group insurance covers. They split the premium. Some employees may receive a reduced amount of contribution if they are in a job share or part-time position, and a single contribution if they are in an AWEC or TPO1 position. Please be sure to check with your HR office to confirm which type of position you are in. The first decision you will have to make for health insurance is which deductible you want to enroll in. What is a deductible? It is the amount of expenses, not including copay services, you will have to pay before the insurance company begins to pay on your expenses. What is a copay? It is a fixed amount the member pays for office service visits. Any amount in excess of the copay is paid by the health insurance company. Please note, emergency room services have both a copay and a deductible. For the purpose of this explanation, we're going to call your deductible choices apples and oranges. With the apple, you have 3 choices. These plans have both an individual and a family deductible. The individual amount is for each person covered on the plan. Once met, the health insurance carrier will pay a certain percent of the claim. This is referred to as coinsurance. We will cover that in a moment. The family deductible is a combination of everyone's individual deductibles added together. Once the family amount is met in any combination, there is no further deductible for anyone on the plan for the rest of the calendar year. The Apples plans also have office visit copays. If you see a primary care physician, you will only have a $35 copay. If you see a specialist physician, you will have a $55 copay. Any service outside of the office visit or consultation, such as radiology, lab work, prescriptions, etc., which were ordered or performed in conjunction with the office visit, will apply to your deductible. The copays do not apply towards your deductible, but they will count towards your out-of-pocket maximums, which we will talk about in a minute. The orange options are called high-deductible health plans because they meet the IRS requirement which allows you to participate in a health savings account. With these options, there is not an individual and family deductible. You choose one or the other. You can enroll in employee only and have a $1,500 deductible, or enroll in employee plus dependents and have a $3,000 deductible. No claims will be paid on until the entire deductible is met, and anyone can meet all or parts of the deductible. Every year, on January 1st, all deductibles start over at 0. I mentioned coinsurance. The definition of coinsurance is, after the deductible is met, the insurance carrier and the employee share a percent cost of hospital medical expenses in a specified ratio. For example, 85% for the insurance carrier and 15% for the employee. Once you have met or satisfied your deductible, your claims begin to pay at the applicable percent or coinsurance. This table shows the highest benefit is for a provider who is in Wyoming and in network. Insurance would pay 85% and you would pay 15%. The middle benefit is the 75% payment by Cigna and the 25% by the employee. This gives you some freedom in who you see as a medical provider. If you choose a doctor out of state but who is in network, they pay 75%. If you choose a doctor who is in state but out of network, they pay 75% as well. The table shows the lowest benefit is for a provider who is both out of Wyoming and out of network. Insurance pays 60% and you would pay 40%. It is always advised that you see in-network providers. These providers have a contract with the health insurance carrier and have agreed to payment amounts. The advantage is that you and the plan save money. With network providers, if there is any balance left after the insurance payment and your payment, they are required to write it off. Okay, now let's talk about out-of-pocket maximums. As previously mentioned, your deductible is money that you, the employee, must pay prior to insurance paying anything. Once your deductible is met, you still have to pay a percentage of the remaining charges. As we mentioned, this is called coinsurance. Currently, that amount is approximately 15%. However, there is a limit to how much coinsurance you have to pay. This is referred to as your out-of-pocket maximum. This chart shows both the individual and family out-of-pocket maximums. As you can see, they are all the same unless you use a provider that is both outside of Wyoming and out of network. Once you hit your coinsurance maximum, then claims will begin being paid by insurance at 100%. These numbers are your coinsurance maximums. Please keep in mind that your actual total out-of-pocket maximum is this number plus your deductible. Also remember that the Apple Plan Office copays are not applied towards your deductible, but are applied towards your out-of-pocket maximum. Any charges other than Apple Office copays are subject to deductible and out-of-pocket maximums. Here are a few details about out-of-pocket maximums. 1. Family out-of-pocket is a combination of everyone covered on the plan. 2. If you use or used an out-of-network provider and they charged you above the allowable, those charges do not count towards the out-of-pocket total. And finally, all deductibles and out-of-pocket costs start over every January 1st. As always, if you need more information on these maximums, please see your health insurance booklet or call us. Our plans also include wellness services. Preventive or wellness services are paid at 100% of a maximum allowable cost for both Apple and Orange options. This is driven by the diagnosis the provider puts on your claims. Separate of the regular wellness is the colonoscopy benefit. On the Apple, you can have one colonoscopy paid for 100% every 5 years regardless of the diagnosis. On the Orange, you can have one colonoscopy paid at 100% every 5 years if the diagnosis is preventative. If the provider uses a diagnosis that is medical in nature, then the claim will default to your deductible and coinsurance. Our plans also include prescription coverage. The prescription drug coverage on the Apple option is a preset copay amount. You can use your local retail pharmacy. Those copays are for 30-day supplies. If you use a mail-order pharmacy, then those can be filled for a 90-day supply for 1.5 copay. The prescription drug coverage on the Orange option is part of the major medical, therefore part of your deductible and out-of-pocket max. After the deductible is met, your prescriptions will be covered at 80%. These are general guidelines to prescription coverage. Other guidelines include step therapy, pre-authorization, and cost differences when brand is chosen over generic. Please see your health insurance booklet or contact us to find out more. This has been some information to help you decide which health insurance option you might want to enroll in. Be sure to submit your insurance applications to your benefits specialist within 31 days from the date your coverage is to start. If you have further questions, again, please contact your benefits specialist or Employees Group Insurance at 307-777-6835 or throw them an email at egi@wyo.gov.